What are some of your most reached for modalities when you're looking to get someone back that are kind of like big bang for your buck, things that you value in the recovery for definitely ACL, given the specialization, but also some of the other injuries that you see that are joint related?
I would say the biggest game changer in my practice, I've been doing this for 13 years, with my post-surgical and my kind of more acute management of injuries was blood flow restriction. It has been just an
Really?
absolute game changer. Yeah, I mean, the ability to be able to just kind of as a general like summary of what it does, it literally allows you to be able to have a physiologic effect on building muscle and being able to like help your body produce more growth hormone and growth factor to be able to build muscle again without having to stress an injured tissue or injured joint. So I can have somebody do a
Wow.
movement that's 20% of their one rep max and have a very similar effect as if they were doing a five by five or a 5 rep max like single leg squat or something along those lines, as long as I'm choosing my exercises wisely. So it allows you to
Wow.
prevent or like slow down the process of like deconditioning and like detraining. That's a big deal for us. So like with somebody who's an ACL or who's in the first 8 weeks post-op, that quad wants to shut down. It's very difficult to keep that quad on. So the combination of electrical stim, so neuromuscular electrical stimulation to really like try to stimulate as many muscle fibers as possible, motor units as possible, combined with something like blood flow restriction, where we can like take the loads away from the joint and the graft to allow it to kind of heal physiologically,
Mhm.
has been an absolute game changer in speeding up that earlier stage of the process to get back to the things that are a little bit more fun, a little bit more on their feet.
If we can nerd out for a second on this, because I find this really interesting. So if you take a joint, we'll stick on the knee here, partially because of the specialization, partially because I feel like there's a lot of people that tweak their knees doing Jiu
Yeah.
Jitsu. You take a knee that flexes and extends. You do something to the ligament. It's compromised. This now affects the contractile force of the quad muscle and the range of motion of the joint. Is that so far correct?
So yeah, so it
Okay.
depending on what the injury is, if it affects the quad's ability to activate fully, it will affect its ability to maintain the strength and the levels of contraction it has.
So is this a neurological issue in that the brain can't get the muscle to recruit enough fibers to cause the contraction to do the joint action? And so by doing the blood flow restriction and the stim at the same time, you're forcing those fibers to get involved where they otherwise wouldn't. How does that whole system working? Like, what is so powerful about blood flow restriction in that rehabilitative process that you might not see if? I mean, I can imagine how it would be super bad if you just gave someone 20% of their one rep max and said squat this, right?
Yeah.
They're going to be on the ground in a second. But what is it about that? What's going on like a muscular level, on a fiber level, and on that brain body kind of neuromuscular connection level?
So when you put the blood flow restriction cuff on, you are restricting 80% of the blood flow. So it includes 80% of the blood flow going into the limb, and it creates a
Mhm.
pooling effect below the level of the cuff that doesn't allow hardly any blood flow to come back up. So basically, what your signal you're sending to your brain is like, that area needs more resources. We need to send it
Okay.
more resources. That's where the release of growth hormone, growth factor, things along those lines that help to build muscle the same way we would if we were doing heavier resistance training. So that's kind of that physiologic part of it from that standpoint. Touching on what you were mentioning with like an injury or like a post-operative swelling will have a reciprocal inhibition effect on the quad's ability to activate, because that swelling makes it difficult for the knee to fully extend. The quad is a knee
Yep.
extensor. So if you can't fully extend your knee, it's going to be very difficult for you to get a very, very like robust contraction of the quad. So as we
Got you.
work
So
on getting knee extension, like let's say I work on somebody on the table and we get like, hyperextension, we get them to be able to contract their quad. The way we get that to carry over is now by applying blood flow restriction training to take advantage of that window where we've allowed the quad a better environment to be able to act. And then now I don't have to load the joint because we're using the blood flow
got
restriction
you.
to protect and preserve the graft in the case of an ACL reconstruction.
So you're mobilizing the joint, then cuffing it, then taking that occlusion and further moving it back and forth. Well, you're getting them to do this, right? So they're calling on the muscle now to do the flexion extension. The benefit is they don't have to be under a squat rack. They don't have to be under heavy loading. They don't have to be in extreme ranges, right? With their Because even so, I mean, coming off an injury, if you're 150 pounds and you do a lunge, that's a ton of weight on that joint, right? So this allows for that process to happen without the loading.
Yeah, because sometimes either post-surgical or post-injury, we just can't load the joint. The joint needs to have time to be allowed
Yeah.
to go through the healing process. And so, but we still want to be able to load the soft tissue without putting mechanical stress and mechanical load on the joint. So the perfect example would be if I want to load up the quads, I'll have somebody do some like quad extension seated on the edge of a table with a 3-pound cuff on their
Yep.
ankle. And then I'll have them do a straight leg raise. And then I'll have them do like a single leg calf raise. And then I'll have them do a hamstring curl on a physio ball. And we're doing 75 reps of each of them with the blood flow restriction cuff on. That's going to stress the tissue, but none of those things I just described are going to stress the joint if we're choosing the right exercises and prescribing it accordingly.
So it makes me think, lifetime as a weightlifter. I've been in a athletic training facility since I was 15 years old as a competitive skier, and ever since then, it's just I'm on a training regimen 24/7. It's just my life. And from competing in Olympic weightlifting to training specifically for grappling, it's something that I love to do. But if I'm being completely transparent, at 34 years old, having been on 6-day-a-week high intensity training splits for Olympic weightlifting, and then on 2 to 3-day-a-week splits coupled with athletic anaerobic conditioning, trying to get better and better and better at jiu-jitsu, it has worn on me. And I hate to admit that. I really do. But the reality is, getting underneath a squat rack now after, myofascial release and warming up and activating and preparation and getting my brain on board and then loading the bar and then ascending the weight and then getting to the working set, right? It is a lot on the body. And when you're also doing an unpredictable sport like we identified earlier, where someone's acting against you and you have no ability to predict, right? I can predict what happens in the training hall on a Saturday morning strength training session very well.
Yeah.
I cannot predict on a Monday noon class who's going to show up, how much they're going to weigh, how tall they're going to be, how fast they are, and their skill level. It's a complete dice roll every time. So when I hear about something like blood flow restriction training and its ability to produce to do physiological responses as if you're at a higher intensity but you're not, why are we not all utilizing this type of training for longevity purposes? Like this sounds incredible. If I can go into the gym right now, load up with a BFR cuff, and then go through super sub-max exercises but get a close to max payoff, should we be doing this more?
This is so the caveat to all of this is it doesn't replace resistance strength training. That's still the gold standard for building muscle. This is the tool, the actual tool of BFR is it bridges the gap when you physically cannot do resistance strength training because a joint post-surgical whatever doesn't allow you to. Now, to kind of like tie it together to what you just mentioned,